These gentlemen need no introduction. We have Dr. Chittal and Dr. Tirthani, Bandra's most loved pediatricians, they're called. And I believe it takes more than 2 hours to get an appointment to see them. And today you've got them all to yourselves. So you can ask them whatever you like, and they're here to make sure that you go away with all your questions answered. So you all have paper and pens. What I'd like to start doing is if you can just, off the top of your head, list down 3 questions that you've ever had about your kids. Or about kids in general, just any 3 questions.
Before I interrupt the audience, I just want to make a comment that when you said that Bandra's most loved pediatrician, I hope you ask the children. I experience that every time I go for a birthday party, at least 4 or 5 children start crying. I can understand those who know me, but even those who don't know me. There's the big bad wolf is here. That's how popular we are, and I'm sure Deepak would agree with that.
Yeah, there was a essay writing, what will you become when you grow up? And he said, I want to become a doctor, so that I can give Dr. Tirthani an injection. Unfortunately, they carry the memories of those shots. Sometimes it's maybe just nice to split the function of a pediatrician between the one who checks the sick children and the one who gives the shots. And if you have a slight division between the two, maybe the kids would be more, receptive to us.
I won't agree with that at all. In fact, I have a nurse who gives one of the most comfortable way of injections.
But the parents insist that they give the shot.
And the babies say hi to her and they start crying when they see me. I've never given a poke to any of the babies.
My first question is, what are the most frequently asked questions? If you had to name 3 most frequently asked questions that mums and dads ask you, what would those questions be?
Well, it depends upon how young the mother is in terms of motherhood. And the first question that when they come for a checkup, how's my baby doing? Obviously. How well am I doing as a mother? That's what is implied, because at home the mother, she's a mother, she's a doctor, she's a nurse, she's everybody. And sorry about the gentleman here, but a very scientific study has shown that when the baby cries at night, 75% of the fathers don't wake up. Of the remaining 25%, 20% get up and go back to sleep. So it's mom all the way. So translating into successful motherhood, how well am I doing is how well is the baby doing? That's what you want to know the first. Second question, unfortunately, when can I start the bottle? So the 2 are such contradictory questions. When can I start the bottle? So I tell them the day you stop loving the baby, give the bottle home. Because when the baby says, I don't love the mama anymore, I love bottle so much. So there are issues about different things. A child who comes, baby who say 1 year old, how do you like, at which school do I put the baby in? When do I go to school? When do I put the baby to school? If the child is 2 years old, when do I plan the next baby? So the questions are focused related to different ages of parenthood. So I'm sure this is age group where you have 1 baby or maybe 2, but the baby is happily in a school, you want to plan the next baby. So how do you plan the next baby? Is that a question on top of your mind? Yes.
Just put it down to symptoms. I think in the first 6 months, the major problems are sleeping patterns and colic and bowel patterns. That's something that obsesses every parent, so most of the questions are focused on that. In the next 6 months, it's the development of the baby, and the parents now start comparing with other kids because now they are interacting with other mothers. So most of the questions are centric around the baby's development versus the neighbor's kid versus the relative's kid, and all the time it's comparison.
My sister-in-law just had a baby, and she sort of sent me a WhatsApp image of the baby in the diaper, and the message was the perfect poo. And I messaged back saying, how do you know this is the perfect poo? And she said she's researched it online. Do you think? And I was like, oh wow. Do you think that, with so much of information on the internet, do you think the anxiety of moms has gone up, or is it helping?
The anxiety does go up. By the way, today's Times of India had an article on the perfect poo.
Oh, okay.
It's like they're doing something called fecal transplants for some very severe gut diseases in the US. And they've actually discovered that they've got a transplant. A mother who was overweight gave a fecal transplant to her daughter, and the daughter became overweight, who was a slim person. So now they've said there should be celebrity fecal transplants. So
I'll
that's
go
just
for Jennifer Lopez's.
off the cuff. Anyway, let's come to more serious stuff. We are coming back to perfect poo. Depending on the age group, the perfect poo for a a baby who's exclusively breastfed, the baby may pass 25 stools a day, which may be absolutely watery. And you know, the way I describe it is like haldi ki pani ki pichkari aur usme fata hua dahi ka dana. And it literally looks like that. When it dries out, there are just seedy granules left behind. But that's the perfect poo for that age group. While when you have a 7-month-old, the perfect poo is one that the child doesn't have to strain, and it passes out without any straining or causing any discomfort to the child, and the frequency is good enough so that there's no backlog and colic. So the perfect poo will vary age to age. Yeah?
Yeah, I don't think I ever thought about what the perfect poo looked like when my son was born. So I'm glad there was not so much of internet at that time.
The oddity about the internet is that it thinks of writing about such topics. I mean, why would anybody
But
write
somebody
about
must have the question, right,
exactly.
in their head.
What's the perfect poo? Exactly. And the thing is, like Dr. Deepak said, that initially baby would pass 15-20 stools a day, 8 to 10 stools with every feed and 8 to 10 feed stools in between. So 15-20 stools a day, and suddenly one day baby decides, I want to poop once a week. Now, depends how old is the baby. A newborn baby till 1 month would poop 8 to 10 big stools, 8 to 10 small stools. Come 1 month, baby says, I want to poop once a week. Now mother suddenly gets anxious. Where is my gold coin today? And so, but that's a perfect poop. 1 stool once a week, a small besan ka laddu in the diaper is once a week. That's fine too. So as long as the baby is comfortable, not losing weight or getting dehydrated, whatever matters. Obviously, the perfect poop can't be for a non-breastfed baby. You can't have a perfect poop for a non-breastfed. They would be either constipated, they would be having discomfort of passing the stool, or a different odor. Of course, you can't have perfume stools, but all the same, you don't have to turn the nose away when you open a diaper of a breastfed baby versus a diaper of a baby who's not formula feed, or a cow's milk for that matter. You need to, oh my God, he's done the job. That's the way.
Yeah, definitely breastfed babies, they have an acidic odor, but it's never malodorous. While a formula-fed baby, the stool would always have an odor.
And you think that's something to do with the way the body digests?
Yeah, the kind of milk protein which is there inside, and that's the major factor, and the milk sugar.
Okay, so do you have any frequently asked questions from dads, or is it only moms who generally are?
With dads, it's mainly about the sleep pattern of the babies because they're more interested in going to work the next day. And as Dr. Chittal rightly pointed out, I mean, they may wake up if the baby cries, but they're more interesting that, can we have some medicine for the baby to sleep better at night? While the mother would more often ask that, what can I do to change the feeding pattern or the burping pattern, or what can I do so that my baby would sleep better at night? Because I do have a baby who's wakeful, and then you have a father who says, I have to go to work the next day, you know.
I mean, dads are involved, but it's like surrogate involvement. It's not, I mean, what can I do? Just standing by and looking up. Can I help you change the diaper? Can I burp the baby? I mean, it's not that they are not concerned, but the involvement is so much hands-on for the mother. It's instinctively and naturally. I mean, that's how God made us. I mean, God made man, that man the provider and the woman the caretaker. And unfortunately, somehow the roles are getting reversed now. The mother is the one who sits at the scale, and the dad is the one, hey, dad gets the chocolate for the baby. So somehow emotional reversal of roles are taking place. But involvement of a baby care, it's so much a woman's thing. It's fortunately or unfortunately. Women can instinctively, I mean, they can talk on the mobile, they can hold a baby and stir a soup. Man would either drop a mobile or he would drop a soup. So women have instinctively been made to the caretaker. So it's that's natural. Dads are concerned, involved in a surrogate way, not directly, which is, I mean, expected, I guess. Unless, I mean, for me to tie a diaper, it took me almost 15 years to tie the perfect diaper. Is there something like a perfect diaper or a perfect wrapper? Women can do it so easily, so instinctively. The way they hold a baby is superb. I have the same
That's
muscles.
because they have a carrying angle that is designed anatomically.
Yes.
You
So
see the carrying angle of the woman. Just do this, and you will see the difference between a male and female. The female's anatomically designed with a carrying angle that's easier to breastfeed the baby. So that's the way they've evolved.
So all dads are now pardoned, you can't hold a baby.
You can't breastfeed the baby.
It'd be interesting to have one woman pediatrician up here because
No, but colic is something that can be so devastating. I mean, I faced it with my first kid, and no medicine seemed to work, nothing seemed to work. In an exclusively breastfed baby, we changed the mother's diet, cut down lactose, they looked in any reference, nothing seemed to work. Till one of my older relatives, my mother's aunt, came to stay with us, and she just nudged, said, "Why don't you try giving the baby a bath every night?" And not a formal, massage, bath, this, that kind of thing, just a hot water bath. So we should just hold her in the tub, and that was delegated to me. And I said, "Well, father has to get involved in the baby, so you do that when you come home." And it worked like a charm. That's it. That was the end of the colic session. Just one warm water bath, dry out the child, change the child, followed by a breastfeed, and she started sleeping beautifully. And we just found a simple solution to the colic, because if you've seen during the day massage, doesn't your baby sleep much better after the massage? For 2-3 hours, the baby is knocked out. So this is not a formal massage, but even a simple hot water bath, like take a bucket 2/3 full, hot to warm water, hold your baby in that chest deep. Your baby actually relaxes after some time. You'll see a tense crying baby relax. You see the limbs turning pink. You see the baby making cycling movements in the water, relaxing. You take the baby out, dry the baby well, fan AC off during that time, and give a feed. And you'll have a baby that at least has 4 hours of continuous sleep, which is a big blessing for any mother. Most babies are at home, and remember the environment at home. The air that your child is breathing is not fresh air, because most of us in Bombay are in apartments where we try and close the windows, we have air conditioning, and you have an air where you have your burps, your effluents, you have phenol bonded furniture releasing that, you have paints which are gradually evaporating off the walls. So one more thing, not in a newborn obviously, but I think every baby requires some exposure to fresh air. And it has been shown that a baby who, like monsoons in Bombay may be a major limiting factor, but during the other seasons, babies who have been exposed to fresh air, especially in the latter part of the evening, in the early part of the evening, tend to sleep better and tend to have less colic than babies who have been exposed, who have been totally, been in a closed room the whole day.
Okay, so we want to make this interactive, and we want this to be
We're
about
waiting for
you
your
guys.
questions now.
So we can go on forever and ever and ever. Yeah.
Okay, so lately I've heard a lot of mothers who have slightly older children saying that maybe you should not let the child sleep in the afternoon, because what happens is my child typically tends to sleep around 11. That's also when I start telling by 10:30, lights off, everything. So people have been telling me that you should not let him sleep in the afternoon. But we grew up with sleeping say an hour and a half, 2 hours in the afternoon, and then kind of figuring out the rest of the evening. So I want to know whether it's a good idea to let them sleep, or whether we should, and what is your suggestion on that?
Initially, for a newborn baby, till the baby is about 6 to 8 weeks of age, baby would feed, sleep, get up, play for a while, feed, sleep, get up, play for a while. So total hours of sleeping comes to about 12 hours plus initially. There are still about 12 hours of awakened status, which just includes feeding, and little burping, little playing out, little looking around. Now that settles down by 6 to 8 weeks, and then gets into the pattern that the baby has prolonged interval between feeding in the daytime, from 3 hours equals to 4 hours, prolonged interval at night time. Baby feeds from 10 o'clock, sleep from 10 o'clock to 7 a.m. So 9 hours of sleep at night, and cat naps in between the day, maybe 1 hour after giving a bath. So the sleeping pattern, the number of sleeping hours does reduce. Post 6 months, the sleeping hours do not reduce. Just distribution of sleep pattern. Total hours are 10 to 12 sleep. 8 to 10 hours is sleep in the night, and at 1 or 2 hours, which is according to your convenience, could be spaced out. That could be 1 sleep hour. You need to have a little nap in the afternoon to get baby to sleep. If you put the baby to sleep for say 4 hours in the afternoon, baby is going to have 2 hours of less sleep at night. So if you can space out, this is called sleep hygiene. How you distribute your sleep. Make a place, time and place conducive for baby to go to sleep. Say at 10 o'clock at night, baby will jolly sleep. Now, many mothers by default wake the baby to feed at night, or whenever the baby wakes up in the night to feed the baby. The baby doesn't necessarily get up for feeding. Now, our sleep is never, including us adults, never have a continuous sleep for 8-10 hours. We wake up at the end of 2 hours. Now, 2 hours is the one sleep cycle, which is distributed 50% as REM and NREM, rapid eye movement, non-rapid eye movement. Peculiarly, we start with NREM and go into REM. Babies have the other way around. We start REM and go to NREM. That's fine. We have a 2-hour sleep cycle, at the end of which we wake up. We adjust the pillow, we adjust the blanket, we turn side, we have a sip of water, we go and come back. Some people make a sandwich and eat and come back. So there is some motor activity which separates 2 sleep cycles. We have many such sleep cycles. Some people can do it 4 sleep cycles, some people do it 6 sleep cycles. Depends upon how many hours you want to sleep. So for baby, to get back to sleep, he has some motor activity, sucking. That doesn't translate into feeding. Baby doesn't get up for feed after 3 months for feeding. He has enough calories stored in his body to sustain the starvation of 6 to 8 hours. So all you need to do is allow the baby to suck maybe for 1 or 2 minutes at the best, or with the consultant pediatrician's consent, give a pacifier in sleep at 6 months. Not in the daytime. It's not a pacifier. It is something to go back to sleep with in the night time. So just 4 or 5 sucks, it falls out of the mouth, baby goes back to sleep. The second disadvantage of feeding the baby to put back to sleep, feeding, I'm talking not about suckling, is the bladder fills up in 2 hours time. Baby pees, you need to change the diaper, put the baby, change the diaper, put the baby back to breast or the bottle, and baby goes to sleep. So this 2-hourly cycle becomes change of diaper cycle. We don't want that. We want to sleep the baby continuously with intermittent sucking to go back to sleep. But that's permitted in the night time. Daytime, no pacifiers. Other the baby picks up time. So it becomes like a push button to put the baby quiet. No, there's no way. It is a button to put the baby back to sleep after one sleep cycle, period.
I noticed my child is 1.5 years old. Even at night, when the pacifier falls up in his sleep, he started searching for it and putting it back to his mouth. I've started, I've tried weaning him off the pacifier during the day, but at night he's himself searching for it to.
Because he's found the diaper in the daytime, he knows what it looks like.
Yeah.
In night time, when he's in the deep sleep, at the end of NREM sleep, when he's going back to the next sleep, they start with REM sleep, remember, and they fall asleep instantly.
Yeah.
We don't. We need to count sheep over the moon and then go to sleep.
True.
Because they start with REM sleep, they start the eye movement immediately. Whereas